Managing and treating chronic constipation. Chronic constipation, or CC, is a long-term bowel problem that affects how your digestive system works. It affects about 15% of people in the United States. Constipation means either difficulty having a bowel movement or having fewer bowel movements than usual. Some physicians consider you to have constipation when you have fewer than 3 bowel movements a week. You might also feel like you want to go but cannot, or you might feel you have not emptied your bowels completely. The best treatment for chronic constipation depends on how your body responds. Exercising and getting more fiber might work for you, or you might need medication. Ask your physician if you should keep track of what you eat and drink and of your bowel movements. They can tell you how to do this. Your physician will probably recommend diet changes first. They might first ask what you eat each day and recommend changes. They might also ask you to work with a dietitian. This is a healthcare professional who specializes in diet and nutrition. Your physician might ask you to eat some dried plums each day. Also called prunes, these fruits are shown to relieve constipation.
Food material in the small bowel is mixed with water, but around 90% of that water content is absorbed by the small bowel. Nutrients are also extracted from the small bowel, and that leftover material or stool passes out of the small bowel into the colon. When the stool enters the colon, we start seeing the water content being stripped away from it in a very active process known as absorption. The stool travels up the ascending colon, past the midsection of the colon known as the transverse colon, and becomes progressively more solid as it heads down the descending colon into the sigmoid colon. The stool is propelled along the colon by the contraction of muscles inside the colon wall, a process known as peristalsis. In the colon, a unique type of peristalsis occurs called mass movements. Mass movements are long, slow-moving, but extremely powerful peristaltic contractions that occur 3 or 4 times a day in the colon. Think of these mass movements as giant waves pushing along a surfer in a pipe. In this case, the surfer is the stool being propelled through the colon in an amazing tube ride. There is another type of peristaltic movement called haustral contractions, which mixes the stool and occurs approximately every 30 minutes.
7 things to help relieve constipation naturally. Our body is made up of 60% fluid. Drinking enough water is extremely important to keep everything moving in your digestive tract. Just think of your colon like a tube. Imagine that you're eating all these foods and they go into this tube, but there isn't enough water to push the food down through the tube. Hence, everything will start to get blocked and eventually harden. Drinking warm water helps to break down food faster than drinking cold water, hence helping you to go to the bathroom more easily and reduce constipation.